Today we'll be talking through the VitalScan Autonomic and Vascular Assessment device. This device is suitable for many different types of physician offices, but primarily useful for general practice and family medicine clinics, as they are on the front lines of many early-stage chronic illnesses. Not only is the VitalScan incredibly useful as an all-in-one diagnostic tool, it also carries great value as an investment for your practice. Patients will often come into the office with unexplained faintness, dizziness, or shortness of breath. These vague symptoms can be caused by a myriad of different conditions. As a physician, how can you quickly assess if the patient is suffering from chronic vascular disease? Another daily occurrence is when a patient comes into the office suffering from sharp pains in the legs or feet. This may be caused by some sort of neuropathy or due to an underlying metabolic illness, such as diabetes. But how can you tell? These aren't the only examples of extremely common symptoms seen daily at physicians' offices all over the country. It is often challenging to recognize if a major illness exists early on in the evaluation of the patient. Common symptoms can be caused by several different types of underlying illnesses, but oftentimes the path to treatment is significantly different for each possible disease state. So what tools do most physicians currently have at their disposal to help quickly evaluate the potential for chronic illness in a patient that's experiencing unexplained symptoms? Well, they can order lab tests, perform an ultrasound or Doppler tests, order an ECG, or refer them to another specialist based on what they think is causing the issues. But what if physicians could quickly evaluate a patient for several types of chronic illnesses from right in the office? Introducing the VitalScan, all-in-one diagnostic tool that can quickly assess if the patient has underlying metabolic disorders such as orthostatic hypotension, vascular abnormalities, cardiac autonomic neuropathy, diabetes autonomic neuropathy. This non-invasive test can be performed in less than 15 minutes from the comfort of the office and produces an easy-to-interpret result report. It consists of 3 tests: the ankle brachial index, pseudomotor sympathetic skin response, and autonomic function testing, or ANS. The patient lies down and follows simple instructions, while the physician or their medical staff administer the short test. Several studies have been conducted as to the efficacy of this particular device. Additionally, the American Diabetes Association recommends testing the autonomic nervous system as a standard of care for patients suffering from type 1 and type 2 diabetes. The American Heart Association recommends using the ankle brachial index in all Americans over 70 years of age, or with anyone over 50 years of age with a history of smoking, diabetes, or circulation problems. The VitalScan offers a tremendous value as an investment for a medical practice with 3 easy-to-build CPT codes. It is covered by Medicare and most PPO plans. So please inquire with us after the presentation. The VitalScan fits into your office. It can be administered by medical staff and patients can be tested while they wait for their examination. It is an all-in-one test that produces immediate, easy-to-understand, printable results. We at VitalScan will provide free installation and staff training. The device comes with a manufacturer's warranty and software updates. We will provide ongoing support for this device, as we see this as a long-term relationship with your practice.